I'm going to actually read out something to you that is obviously something that people think very highly of you. Please thank Jamie for all the work he's doing and the information he is sharing. I'm now paraphrasing because it's gone off my screen, but I noticed that came in. So there you are. You got a fan, and we haven't even started.
Well, that's good news. No, I think so. The main thing I think, Nick, people have been talking about is this 90% number. So
Exactly.
let's go back a few weeks now. So it first surfaced in the Sunday Times. There was an article on the front page of the Sunday Times saying that 90% of patients in kind of hospital in intensive care units were unvaccinated. Now, at the time I was questioning the numbers. A few other people were questioning the numbers. So let me just explain where that number firstly came from. And
Can
then
I
we
just
can
ask,
talk
Jamie, are
about...
you talking about 90% hospitalizations or 90% in ITU? Because they were both out there, weren't they?
Yeah, well, it was kind of brought around as 90% kind of in intensive care.
Yeah.
So we'll talk about hospitalizations in a sec. But what that number was, is it was actually looking at, and it was information from NHS England that hadn't been put into the public domain at the time. A complaint was actually made to the statistics watchdog by James Wells, who used to work for the ONS as well, and they criticised the NHS for not putting it into the public domain. And let me just explain where that number first come from then. So what it was is that these were patients who needed the most extreme kind of care. ECMO, I think, is the kind of the very extreme care that you need in the NHS. And it was 154 patients over from July, I think, through to November. So, you're talking a huge period of time. And 141 of those 154 patients were unvaccinated. So that's kind of where that 90% number started from. But let's look at that in some kind of context. Over the same period of time, 100,000 people were admitted to hospital with COVID to the NHS. So you're talking about 0.14% of all those patients that went into hospital to start coming up with these claims on the front of a national newspaper. And over the same period of time, it was 4.2 million cases. So I think the headline itself, it was very kind of selective in what the data was picking out. But then from the same kind of numbers there, Nick, you had Nadine Dorries then putting out tweets saying that 9 out of 10 in ICU. So ICU is more broader than these 154 patients were unvaccinated. So I challenged her on Twitter for that. And again, a complaint went into the statistics watchdog about her. She then clarified that she was relating to these numbers that I've just talked about, which aren't the numbers. So what we do know now, Nick, is that the intensive care research teams at ICNOC, what they've done is they've linked the NHS data to the kind of the intensive care data on vaccination status. So the authoritative number that we currently do have is that for patients in intensive care who are unvaccinated is 48%. So that's the actual number. It's not 90%.
Jamie, can I ask you on that? Looking at the ICNARC data, which is not that's not the ONS or that's not the NHS as such, is it? That's a separate body, as I understand it. Those numbers only go up to the 15th of November. Have I got that right? Because we're all pretty interested in the impact of Omicron, which of course wasn't really around at that time. So is it absolutely impossible to get current data on the number of people in ICU who may or may not have had the vaccine, or any data on the people on ICU?
So we rely on this ICNARC information. Ironically, Nick, it was about 3 or 4 weeks ago they published the data, and it was only up to July, and there was a lot of people saying that 3/4 of patients in intensive care were unvaccinated. But obviously, up to July, there was very few people who were fully vaccinated at the time, so that's not unsurprising. So they did come out, they worked with NHS to get more information, and they published that. So that is the latest information up to the 15th of November. And so, but I think one thing, this isn't about the vaccines don't work because lots of people are in ICU. Let's remember, the vast majority of people in the population are vaccinated. So, just to explain that if you are unvaccinated and you've got similar personal characteristics to somebody who is vaccinated, does vary significantly, but you are more likely to be admitted into ICU if you're unvaccinated, because remember, the 48% is a higher proportion than what the full kind of population of unvaccinated are. So, this isn't against vaccines. Vaccines do have an impact. They are positive, but the ministers are going out making claims and politicians are going out making claims which are false. And ironically, when you start looking into the same report, Nick, you actually find that people who are kind of severely obese are way overrepresented in kind of intensive care as well. So it's not just your vaccination status that's a critical factor in all of this.
Okay, now look, I just want to come on to another point, which I felt did get in the public domain much more in a way than this one, because I personally don't think this 90% figure has been challenged even enough. And it would be interesting to see. Well, let me stick to this point first of all. Yesterday, 2 days ago, the Prime Minister came out and then and made this statement, and he was relating to those who have not had the booster. How is it even possible for that data to be available? Because it then dribbled out that, oh, well, we're just talking about a few hospitals we visited. I mean, that was a gross misrepresentation, if you ask me. It gave the implication that this was right across the country, but it was actually a few hospitals, as I pointed out yesterday. But would we even collect data, or would ICNARC collect data on those who are in intensive care, on how many vaccines they've had, and will we actually see this data?
So I'm sure we will get to see that at some point. I don't understand why the NHS themselves need to rely on ICNARC to do this information. Yeah. Anyway, they know who's in intensive care. They know the vaccination status of all these patients. It may be that it's more difficult to publish it every single day like they do with the other numbers, but publishing some periodic numbers doesn't make sense. Now, the Prime Minister here, I think you bang on the money there. It's been quite common by ministers, and Boris in particular, where they will say, well, anecdotal data from a couple of trusts have got this. That clearly doesn't represent the full kind of situation. And you can see with the words that Boris used, he has changed the tone slightly to say those who haven't had a booster. So that will obviously include people who are unvaccinated, people who've had one dose, and people who've had 2 doses. And it's a gross misrepresentation of what potentially the national picture is. I would imagine, Nick, that in London, because we talked about that 48% figure, they don't break it down regionally, but London does have a higher proportion of its population who are unvaccinated. So it's likely potentially that the 48% is higher in London, for example, than it is nationally. But it's not really 9 out of 10 is a representation nationally. And Boris might have been, just finish on this point, Nick, Boris might have been bang on and right there, but the data is not in the public domain. But we also need to know, how many of them have had 2 jabs, 1 jab, unvaccinated. Just saying not had a booster and then that being quoted all over the media is a bit misleading as well.
And I think counterproductive, because if you start to lose faith in the data, if it starts to get challenged and it's credibly challenged, that actually undermines what they're trying to do, which is get more people have boosters. But the other thing which I want to talk to you about is in London. You mentioned London. So we were getting the daily number of COVID admissions going into London. And it actually, and I think it was on this station quite regularly, people were challenging this. That was not the true picture, though, was it? Because people are going in for all sorts. More and more people have got Omicron, whether they've had a test or not. They go into hospital, they get a test for something else, and it turns out they've got Omicron. That data was fundamentally misleading. And yet, how easy now is it for us to identify if you've been into hospital for a primary reason other than COVID or COVID? Is it easy now for us to find that out?
So the NHS started several months ago, started publishing people who are going into hospital where COVID is the primary reason, and people who are going in where, incidentally, for example, somebody might need to go into hospital because they've needed an operation on a leg, for example, and they tested positive. They split those numbers out. So what we do know now, Nick, at the moment, and you're right, we're starting to see the proportion of patients going into hospital in English hospitals who are going in with COVID but not being treated specifically for COVID is going up. It's currently around 29%. So that means 71% of the patients who are in hospital are not primarily being treated with COVID. But there's another aspect of this as well. And that's patients who are already in hospital who catch COVID in hospital as well. And we can kind of estimate that around 20% of patients at the moment, in the last 7 days, about 1 in 5 patients in the numbers caught COVID in hospital. So they weren't admitted for COVID, but they're in there. So it could be that we're close on half of the patients in hospital are in there with COVID, but not specifically because of it. And the important thing, Nick, is that if you're in a position where, say, everybody in the population had Omicron,
exactly,
then everybody in hospital will have Omicron, and every death that's recorded will have Omicron on there.
So these
that's where you've got to be
they
careful.
become meaningless in effect at some point. Jamie, I've got a question. I'm running over time here, so I'm fully prepared to get told off for this, but it's so good to have you. Actually, Kevin McDonald has sent me this on Twitter, and he's shown me a graph where it shows that COVID cases were up 45% across the UK in the past week, but he's broken it down by the devolved nations. So England 38%, Northern Ireland up 88%, Scotland up 96%, Wales up 117%. Could you draw from that conclusion that those countries that had, if you like, restrictions in place, unlike England, which didn't, and has the lowest increase in cases, would I be guilty of doing what the government doing, misusing the statistics? If I turned around and said, well, that shows restrictions like masks and all those restrictions they've had in Wales and England, they don't work because their cases have gone up more than they have in England, where we were much more liberated.
Yeah, those numbers, I think, might be numbers I tweeted out yesterday. So the important thing there, what they are, is they're the last 7 days cases reported versus the previous 7 days. Now, the restrictions have only really come into force, the extra restrictions, after Christmas. So it's probably still early days. And remember, England had this big rise in London to start with. I think what is probably going to start showing, Nick, and that's why it's going to be interesting to follow these over the coming weeks, is, all these extra restrictions, do they have any impact whatsoever? Because in Wales, where I live, you can't now have, a good example is on Boxing Day, and it'll happen again tomorrow on New Year's Day. People couldn't watch the rugby match outside because there was only 50 fans were allowed. So 150 were packed into the clubhouse watching the same game when they couldn't go outside and watch it. That's going to increase the spread of the virus. We've got some really stupid rules in there.
Jamie, I'm going to have you back. Thank you very much.